Here with Radio 5 Live Drive. Thank you so much for your company this afternoon. Now, safety investigators are saying doctors, ambulance dispatchers and other NHS staff in England have faced significant distress and harm over the past year as a result of long delays in emergency care. The Healthcare Safety Investigation Branch says many staff broke down in tears when they were asked about their working environment. NHS England says it takes staff well-being very seriously, while the government said the number of ambulances and hospital beds was being increased. However, the watchdog said there was likely to be an impact on patient safety. Dr Salwa Malik is an A&E consultant and Vice President of the Royal College of Emergency Medicine. Before we came on air, she gave me her reaction.
It's not surprising at all. I think the really sad thing is that it just shows how unsupported we are as a healthcare profession, really, in order to cope with the sort of problems that we're seeing every single day.
I'd imagine a number of our listeners are thanking their lucky stars right now that they've had the good fortune not to have been in a hospital or an accident in an emergency department recently. But can you just paint a picture of what it's like right now, Salwa, and how difficult it is to work in those conditions?
Yeah, absolutely. So I think the important thing to understand from the public's perspective is how little preparation and training one is given in order to encounter what you do encounter every single day, whether you're in A&E or you're in primary care or you're on the wards or in clinics. There is very little attention given to this topic, which is actually really quite sad. But the day-to-day, encounters that we have, if I just describe, certainly from the emergency medicine point of view, you go from, resuscitating a patient who's critically unwell to then having to deal with verbal and physical abuse from a patient or maybe a relative, to go to breaking bad news to a loved one or to a patient about a condition they may have, to going to then having to sort of fake a giggle with a little child whilst you try to distract them and you try to examine them or try and do a blood test or something, to then go to a cardiac arrest or a major trauma. It's up and down persistently for, 10, 12 hours on a shift. And then you've got to repeat it again and again and again and again and again. It is an emotional roller coaster. And then if you imagine doing that, because we know that job, that's what we signed up for, that's what we understand. But imagine doing that when you're then faced with patients that are lining up and down your hallways or your corridors, as we call them, patients that are unable to get off ambulances into the A&E department, faced with having to make that choice of which patient gets that one bed in the resuscitation room. Is it the 30-year-old patient who's quite septic from an unknown source, or is it the 87-year-old who's extremely frail, who's fallen down a flight of stairs? Who gets that bed? And that's incredibly tough to make that kind of decision and to put that kind of onus on our staff. But it is a decision we're having to do every day because of the pressures that we're facing. So imagine having to do that normal, what we consider as normal, but it is not normal. Our job is not normal. But imagine having to do that normal day-to-day activity with that chaos happening, and then imagining doing that for 10 years. Mm-hmm. And then imagine doing that with the kind of winter pressure that we've had recently. It is phenomenal. And you can understand then why the amount of, stress, burnout, the lack of well-being of staff has really caused a lot of people to leave, because unfortunately that is how people are coping. That is how people are keeping themselves together, by actually putting themselves first and saying, I can't do this anymore. And that's really sad, but understandable.
How close have you been, Salwa, to walking away from the profession?
I love this job, right? This is what I do. This is my bread and butter. I've dreamt of being an emergency medicine consultant for years and years. I'm not going to leave this job. But I have to say, in December and January time, I was thinking, well, why don't I go somewhere else? Mm-hmm. I look at colleagues that have gone to New Zealand, to Australia, to the Middle East, living a much better life. And I felt, I did think to myself for the first time, well, I could easily just do that.
Hmm.
But I think I have family commitments here. I have reasons to be here in this country, and that's probably why I've not gone. But it certainly has crossed my mind, and I know that other colleagues have thought similarly. But I guess the way that we respond for if we can't leave the country or the profession is by saying, well, we'll just reduce the amount of clinical hours that we're doing in order to protect ourselves. And that is what the trend is now. Consultants, junior colleagues working less than full time in order to look after themselves and all to do other really important activities as well as being on the shop floor.
To become an A&E consultant, you have to be an incredibly academic person. But where do you find the emotional resilience from? How do you learn that? And how do you learn to cope with what you've just described, with so many big decisions to make in such a short period of time, with a huge range of emotions flying around?
Yeah, absolutely spot on. So you're not taught. There is no training. I think the perception when you come off the block from medical school is just get on with it and just deal with it. I'd like to think that in the last 15 years, there has been a dramatic push towards resilience training, well-being, how to make decisions, how to prioritize. But the matter of the fact is that it really isn't done very well. And, if it was achieved, we wouldn't be seeing the problems that we are now. Of course, I'm talking from someone with experience. I've obviously been in the game for a while. And I'm worked with colleagues that have been there for even longer than me, very wise old birds that I work with. And I guess you watch and learn and observe where to spend your energy and where not to spend your energy, as in what battles you can choose to fight and what battles you just have to let go. And unfortunately, the main battle that you have to keep charging on with is patient safety. And we will always charge on with that at the forefront. But there is no training, there is no real support. And that is a real shame because, like I said, what we do is not normal.
No, it's not. It's not superhuman,
normal,
actually.
And I think we have to acknowledge that.
Yeah, and I think this is the thing the Watchdog has said, hasn't it? That there is an impact potentially to patient safety. And you've just mentioned how important that is. It's the first reason, the first principle of everything you do. So how scary a prospect is that for you, that could become an issue with the level of stress and pressure on you and your colleagues?
Well, definitely. I mean, when you think about it, we tell drivers, if you are tired, do not get behind a car. Do not get behind a car and drive. The same principle applies to your surgeon. Do you want your surgeon who's operating on you to be tired and stressed and burnt out? Do you want your GP not being able to make very quick decisions in the 10-minute slot that they've got? Or do you want your A&E consultant, your A&E junior to miss something? I mean, this is incredibly important. When you are stressed, when you are burnt out, you can't sleep. You drop your attention level, you can't concentrate, you can't switch off. These are all very real signs of stress and burnout. And of course, that is linked to patient safety. So there's even more stress on top of that, because what happens is you then naturally slow down. And when people want you to get on with it and be quick and see this patient quickly, and the patient wants you to be seen quickly, and the relative wants to know what's going on, you have to slow down because you don't want to make a mistake. And I would urge people to understand that, emergency departments are still safe. They are the right place for patients to be, and we will always prioritize our patients. It's just that in order to make decisions, sometimes we get to slow down a little bit in order to make the right decision. And sometimes we will double check ourselves and we will ask other people, am I making the correct decision? And that again is another safety net for us. But also it's sort of something that flags to me as a concern that we're getting tired, we're getting stressed, we're getting overburdened.
So I should say a spokeswoman for the NHS in England said the safety of both patients and staff is vital, and the NHS takes staff health and wellbeing incredibly seriously with a range of support, including dedicated helplines, wellbeing apps and coaching, as well as the option of flexible working. Now, as somebody right in the middle of it, is that something that you've used or found at your fingertips?
Nope. I've never needed it. Not that I've not wanted to. I don't find it is very accessible, unfortunately. I think for our junior colleagues, we certainly do point them in these directions because we supervise them quite heavily. So we do point them in the right direction for these support services. But I think as you go up the ladder a little bit, you're kind of felt it is perceived that you should just be able to handle it. And I think also there is that pressure of just handling it. And so I feel that, actually it would be nice to actually have a clinical psychologist come in as a routine every 6 months to make sure I'm okay.
Yeah.
And whether I choose to engage in that hour or not is different. But I think it is something that, NHS England should think about, because I think, what we do is not normal. We deal with incredibly difficult emotions, with people's lives in our hands. And we're not even getting the right support to debrief. Well, so I would like to challenge that back.
Yeah, well, Salwa, I really hope you're still working here and not in sunnier climes next Christmas, if that's the right thing to say. Dr. Salwa Malik.
I'll be here, don't worry, till the end.
It's Dr. Salwa Malik, an A&E consultant and Vice President of the Royal College of Emergency Medicine. Thank you so much for your time and best of luck.
Thank you very much for having me.
Gordon Smart and Claire McDonald here with 5 Live. And, Claire, I've spent a lot of time with 5 Live in the last 6 months talking to beleaguered and stressed and tired NHS staff, A&E consultants, nurses, paramedics. And perhaps you'd like to get in touch if you're feeling the same way as Salwa Malik, who we just spoke to there. 85058. Are you feeling beleaguered and tired and stressed out? And as we heard there, on the brink of tears when asked about their working environment. Get in touch, 85058.
Yeah, we